Factitious disorder is a complex mental health condition that often leaves medical professionals and loved ones puzzled. It's a disorder where people intentionally create or exaggerate symptoms of illness or injury. This isn't about faking a cough to skip work. It's much deeper and more serious than that. People with factitious disorder go to great lengths to appear sick. They might lie about symptoms, tamper with medical tests, or even harm themselves to produce real symptoms. The key here is that they're not doing this for obvious external benefits like money or time off. Their reasons are psychological, often rooted in a need for attention, care, or a sense of identity as a patient. Imagine someone who constantly visits doctors, complaining of various symptoms. They might have a long, complicated medical history filled with rare conditions. They undergo numerous tests and procedures, sometimes even risking their health in the process. To the outside world, they appear chronically ill. But in reality, they're creating this illness themselves. The severity of factitious disorder can vary widely. Some people might exaggerate real symptoms they have. Others might completely fabricate illnesses. In extreme cases, individuals might actually make themselves sick on purpose. This could involve actions like contaminating wounds, injecting harmful substances, or interfering with their own medical treatment. Now, you might be wondering how common this disorder is. The truth is, it's hard to pin down exact numbers. People with factitious disorder are often very good at hiding their behavior. Plus, many healthcare providers aren't well trained in spotting it. However, some estimates suggest it might affect about 1% of hospital patients. It seems to be more common in certain medical specialties, like neurology, dermatology, and gastroenterology. Causes of factitious disorder. The answer here isn't simple. There's no single, clear cause. Instead, researchers believe it's likely a mix of different factors. One important factor might be childhood experiences. Many people with factitious disorder report difficult childhoods. They might have experienced neglect, abuse, or inconsistent care from parents or guardians. These early experiences can shape how a person views relationships and attention. For some people, being sick becomes a way to get the care and attention they missed out on as children. Another potential factor is early exposure to medical environments. Some individuals with factitious disorder spent a lot of time in hospitals as kids. Maybe they were sick themselves, or perhaps they had a family member who was often ill. This experience might lead them to associate being sick with receiving care and attention. Personality traits can play a role too. People with factitious disorder often struggle with low self-esteem and a shaky sense of who they are. They might have trouble forming healthy relationships. For these individuals, being a patient can become a core part of their identity. It gives them a role to play and a way to connect with others. It's important to note that factitious disorder is different from malingering. In malingering, people fake symptoms for clear external benefits, like avoiding work or getting pain medication. With factitious disorder, the driving force is psychological. The reward is the experience of being a patient and receiving care. Symptoms of factitious disorder. The symptoms can be incredibly varied. After all, people with this disorder might fake or induce almost any medical condition. Common physical symptoms include things like abdominal pain, chest pain, fever, or seizures. On the psychological side, they might claim to have depression, anxiety, or post-traumatic stress disorder. But what does it feel like to have factitious disorder? While it's hard for those without the disorder to fully understand, we can piece together some insights from research and patient accounts. Many people with factitious disorder report feeling empty or lost when they're not playing the role of a patient. Being sick gives them a sense of purpose and identity. At the same time, they often feel guilty about deceiving others. This guilt can lead to feelings of shame, which paradoxically might drive them to continue the behavior as a form of self-punishment. The process of maintaining the deception is often stressful and exhausting. People with factitious disorder frequently become experts on medical conditions. They spend hours researching symptoms and treatments to make their stories more convincing. This constant state of alertness and performance takes a heavy toll on their mental health. Despite the negative consequences, many individuals with factitious disorder report feeling a sense of relief or excitement when they successfully convince others of their fabricated illnesses. This positive reinforcement can make it very difficult for them to stop the behavior, even when they recognize it's harmful. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of factitious disorder. Diagnosing factitious disorder is tricky. Unlike many medical conditions, there's no simple test that can confirm its presence. Instead, healthcare providers have to piece together clues from various sources. The diagnostic criteria, as outlined in the DSM-5, which is the manual used by mental health professionals to diagnose mental disorders, include several key points. First, the person must be intentionally faking or producing physical or psychological symptoms. Second, they must present themselves as sick, injured, or impaired. Third, this behavior occurs even when there are no obvious external rewards. In practice, healthcare providers might suspect factitious disorder when a patient's reported symptoms don't match up with test results. They might become suspicious if treatments don't work as expected, or if new symptoms keep popping up as soon as others are resolved. Inconsistencies in the patient's medical history, an unusually extensive knowledge of medical terminology, or a history of frequently changing doctors might also raise red flags. It's crucial for healthcare providers to approach suspected cases of factitious disorder carefully. Confronting the patient directly with accusations of lying can backfire badly. It often leads to denial, anger, and the patient abruptly ending their care. This can be dangerous if the patient has real medical needs alongside their factitious symptoms. Treatment for factitious disorder. The treatment here is often a long and difficult process. The main goal is to help the person find healthier ways to meet their emotional needs and develop a stronger sense of self. However, many people with this disorder resist psychiatric treatment. After all, accepting help threatens their ability to maintain the sick role they've come to rely on. The first step in treatment is usually trying to build a trusting relationship between the patient and their mental health provider. This can be particularly challenging given the deceptive nature of the disorder. Therapists have to walk a fine line between acknowledging the patient's distress and avoiding reinforcement of their factitious behavior. Psychotherapy is the main treatment for factitious disorder. Cognitive behavioral therapy is often used. This type of therapy helps people identify and change harmful thought patterns and behaviors. For someone with factitious disorder, this might involve challenging beliefs about needing to be sick to receive care or attention. Psychodynamic therapy can also be helpful. This approach digs into the person's past experiences and unconscious thoughts. It might explore how childhood events have shaped the person's need to assume a sick role. In therapy, people with factitious disorder work on developing healthier coping skills. They learn to improve their self-esteem and build genuine relationships. A big part of treatment is learning to tolerate and express emotions in more adaptive ways. Family therapy can also play an important role. Factitious disorder often strains relationships with family and friends. Therapy can help educate loved ones about the disorder and teach them how to be supportive without enabling the harmful behavior. In some cases, medication might be prescribed. This is usually to treat co-occurring conditions like depression or anxiety. However, healthcare providers have to be careful when prescribing medications to people with factitious disorder. There's a risk the person might misuse the medication or intentionally overdose. It's important to understand that recovery from factitious disorder is usually a long-term process. It requires patience and persistence from both the individual and their treatment team. Relapses are common, and treatment plans often need to be adjusted over time. Now we want to hear from you. Do you or someone you know have factitious disorder? Were they actually sick? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.